Good evening, everyone. We are here with yet another session. Today, we are here with Dr. Mukta. She has completed her BNYS in 2021. She has done her course in behavioral psychology from IIMB. She has also done happiness psychology from IIT Roorkee. She has perceived ozone therapy in the Pune, and she is a brain gym trainer from last 1 year. She has won 5 national awards for writing about how naturopathy can help maintain good health and tackle various issues in the clinical settings. And she has written articles in WHO, United Nations Journal on Naturopathy, and it's proof in Sanskrit text or ancient text. And she is also currently working as a lifestyle trainer in corporate sector. With this small introduction, I would like to welcome you on our platform on your broad. Thank you so much for your time.
Thank you so much, Dr. Bhavit, for having me with you guys. Shall we start?
Yes.
Okay. So we are going to discuss about effective pain management. We will start with what is pain. So as we know, it is like people think that, okay, pain is just because of some repercussion of bad medicine or not good posture. But I think in a broader way, we can say that pain is part of body's defense system. So whenever there is a pain, there is obviously some postural deformity, or there is something wrong we are doing. Sometimes we sleep in a wrong way and we can have a neck pain or like a body pain. So this is a body's way of saying that there is something wrong and you have to do something about it. So we will discuss about the common factors about why it occurs. So we have seen that in nowadays, the most common factors of pain are occupational pain, faulty lifestyle, postural defect, nutritional imbalance, medicinal side effects, stress-induced pain, pain due to other prevailing diseases, and psychological pain. So all these factors are very commonly seen nowadays that cause pain. Occupational pain is the most common among all the pains because I think 8 to 10 hours or 12 hours people are spending mostly in their job life or career life. And if there is any problem in that, like sitting posture, not having proper chairs to sit, not doing exercise, not taking out time to walk, or not getting into the sunlight, this all things are general factors for the cause of pain. We will discuss about the common way of how people deal with it. So mostly people avoid it कि अभी है पेन चला जाएगा थोड़ी देर बाद let us ignore it. कई बार लोग पेन किलर मेडिसिन लेते हैं, होम रेमेडीज ट्राई करते हैं, डॉक्टर के पास जाते हैं, प्रिस्क्राइब्ड मेडिसिन लेते हैं, ऑपरेशन करते हैं, and still we have seen कि 90% of the time pain is still there. So let's discuss that how we should actually deal with the pain to effectively combat it. So we can first identify the root cause. It is very simple thing to say कि root cause find out करना, but it is very difficult to actually find a root cause of lot of kind of pain. In my course of time, like when I'm practicing, I have even seen people having back pain. Like I encountered so many patients in the recent time having back pain because of eating rice in the night time. So I think every small factor is very important when you are checking for the cause and the root cause of the pain. So this is a very important thing. We can consult any doctor, that is not that, but we can obviously go to a naturopath first because they will give you more subtle and natural way of combating with the pain. The third most important part is to know our treatments thoroughly, and we will see why. So we are here, we will discuss some myths and facts about the naturopathic treatment that we give to the and how they can affect the patient as a whole. So when it comes to yoga and exercise, most people are like, we will do a set of exercises. This is our routine and we don't want any changes and we will continue. But this is not correct way of dealing with the pain or dealing with the exercise routine. You should always keep changing it. Some people have a weekly routine and they will again repeat the routine next week, or some people will add or subtract some of the exercises or yogas that they are doing. It is always progressive routine should be there, and you should always consult an instructor unless and until you are trained under some organization or some institution. Apart from that, you should always consult before changing any posture or adding any asana to your routine. Diet, I think very common myth about the diet is that one diet which is followed by some people will help us also. Mostly we have seen कि WhatsApp पे कुछ आ जाता है कि ये काढ़ा पी लो, ये चाय पी लो, इससे ये सही हो जाएगा. I think that is not. Am I audible? Okay.
Yes.
Every person have their own body type and structure. So not think that is working out for someone will work out for the other person as well. And I think this is a very common myth, and I've seen a lot of people struggling with this thing. So I would obviously say that please consult your doctor, know your prakriti, know your body, and then decide a diet for yourself. Hot packs. So in my recent, in one of my sessions, there was one patient who told me that she's taking hot pack for 30, 40 minutes, 50 minutes, and still she's not able to get relief from the pain. So I think this is a very common myth that people will check out from the internet. They will think that, okay, 15 minutes, 20 minutes, 30 minutes of hot pack is okay, but it is not correct. Even if we go by Ayurveda or we go by naturopathy, hot pack has some duration. We should follow that duration. It is not that ki zyada time rakhne se we will get better effect. Also, hot has its primary and secondary effect. We have to check out for what effect we want and give the hot pack for that particular time. I think 5 minutes is the for the primary effect we can give for 3 to 5 minutes, whereas for the secondary effect we can give for 10 to 15 minutes or maximum 20 minutes if we are combining with the cold pack. So alternation we can give for 20 minutes, but not more than that, because it may cause the white blood cells to accumulate over the area where there is pain and cause inflammation. So let's really we should tell people that what is the time limit for it, and people should not take anything just like that. Cold packs are mostly avoided, but actually cold has a very good impact for the pain area. It increases your blood circulation and reduces your inflammation as well. Cold has its own effect. It will help in dilatation, and then it will first contract as a primary effect, and secondary effect it will give dilatation, which helps in improving blood flow. Improving blood flow will improve the access of white blood cell to the area where there is pain or inflammation and help reduce it. So cold and hot pack can be given in alternation, or we can first check the condition. We can know what is required, and then we can decide what pack we should give. Next, we will go to mud therapy. I think people don't really believe in the power of mud therapy. They don't to take mud as a therapy. They are always seeing it as an alternative therapy. But in many research paper currently, they have shown that mud has a very good effect on arthritis, osteoarthritis, and knee pain condition. So wherever there is a hard joint, like your elbow joint and knee joint or ankle joint, we can use mud therapy to relieve pain in that affected areas. Last and little bit differences there, but mostly they have almost same kind of results. Acupuncture and ozone give very good result at the beginning. I have seen that people get relieved after 2 to 3 days. after like first session itself in both ozone, but the fact is that ozone is working on your nervous system. It is just confusing your mind to avoid, like, to not detect pain, but pain is still there. So acupuncture will just give you time. In fact, ozone also, they both are a therapy which will give you time to get relief from the pain and actually work on the cause of it, like maybe do exercise, improve your diet, or improve anything that can help it or actually combat it. But people think that, okay, we took acupuncture, now it is a permanent cure, and now we don't need to take it. But after 3, 4, 5 sessions or second sessions we take, they are not getting so good of the result because of the fact that they are not a permanent cure. Also, acupuncture is working on the fact that your dorsal horns are not able to identify two kind of pain. So after a point of time, acupuncture needle are unable to create that acute or chronic pain to confuse the brain, because people are used to that needling pain. Also, same for the ozone is like giving O3, and at some particular point where there is a lack of oxygen or the blood circulation is low, it is giving your direct oxygen to that part. But it has its limitation as well. This is also not permanent solution. None of this is permanent. Only permanent solution to curing your pain is to identify the root cause. I think that is the most difficult part. People sometimes do a lot of things to actually identify that it is maybe in the food. Like we have seen that eating pulses or dal or rice in the night causes pain to lot of people, especially back pain. We have seen during this rainy season that many people had this problem, and I realized that, okay, everything is so important when it comes to any discomfort in the body. It is a body's way of telling you that there is some problem, and we have to work toward it to combat it. Okay. We always say that naturopathy is not harmful, and it is it is a natural way, but it is trustworthy and least harmful way. But we cannot say that it is not harmful at all, because sometimes people don't know that they have some allergy or some postural deformities there, and people sometimes recommend they will have this diet issues. They will not be able to combat with the diet which is given by their physician. So it is very important to know that it is also harmful in some ways if it is not given in a proper way. Even taking hot pack for long time, we have seen skin rashes and loss of skin sensitivity, because some people are continuously taking hot pack for, like, they are not feeling well or relaxed, they will put their legs in very, very hot water, which is not correct. There is a particular temperature. Even the mud is to be heated till 100-degree Fahrenheit and not more. Hot pack also, we have certain temperatures given. We have to work accordingly so that we can actually cure disease and restore health in a proper natural way. Thank you. You have any doubt regarding this, you can ask. Apart from that, we are done.
So thank you so much for your presentation. And there are a few questions which I would like to ask you, that how do you
Yes.
deal with the complaints when a patient comes to you? Because there are some times when they know all these
Your
therapies.
your voice got break. Your voice got break.
Am I
How
audible?
do you? Hello.
So my first question would be to you, that how do you deal with these naturopathy therapies when they say they know and they are doing it every day?
I have seen that people think that it is they know, because every time I see some patient, I think they have this pain because they're unable to identify the root cause of it, or they're unable to actually do their treatments like effectively. As I said, that I have encountered that lady who said that, okay, I am taking hot pack every day for 1 hour, 40 minutes, and it's not working, but it doesn't work that way. So that is our duty. I think a doctor's duty is to know the other person's body well to actually cure the disease. So if the person is doing the treatments properly and doing everything properly, they may not have the pain itself in the first place. If they are having any discomfort in the body, it is because they are doing something wrong, and that is our duty to find out. So every time I am very positive about the fact that, okay, first we have to know everything about that person to know that where the problem lies. So I don't think that it is very difficult. If you really want to find the root cause. Hello.
So my second question would be that how do you deal and how do you see how naturopathy therapies are helping and how can you guide the future DNY students who are
Your
going to
voice
come
got
out?
cut again. Your second question is that?
Hello.
Now I can hear. Yeah.
Yeah. So my next question would be to you that how do you teach or guide the naturopathy students in these kind of factors where they can train themselves in particular therapy and can treat a patients in their setup?
I think everybody trains themselves in the therapy they like. Like I was always very curious about acupuncture. So I used to study it since the first year itself, though we have it in the fourth year. It is always about the interest. But yeah, for guiding, I always say that we should be ready to learn. We should not think that, okay, this is the perfect knowledge I have. I don't need anyone's help, because even during my internship, whenever we go to different places or we go to different institution, they have their own belief, they have their own set of rules, and all of them are curing, all of them have lot of patient coming and believing in that institution. So I think it is our way to model our strategies, but we should always first try to understand other people's strategy. We can follow them for some time, and slowly we will know that, okay, this kind of patient is coming to me, maybe this kind of therapy is working for them. So with time you will be set on your own. You don't need to do anything different for that. You go with the flow, you learn, you will know that, okay, this is what I want to do. Similarly, I worked in some institution, we had some kind of things available, some things were not available, so we made a protocol out of what is available. So that is how it works. I don't think there is anything different we have to do for that.
So my what would be your last message to everyone who are going to watch this session?
I think my message will be that believe in all the therapies, but always go by the least harmful therapy. So naturopathy really gives you a lot of area to explore. So I think you should first try some natural ways. You should consult a naturopath, and maybe if that is not working, you can go to other institutions. So be positive and try natural way of healing. If it doesn't work out, we can see what can be done.
So with
Okay.
this, thank you so much to come on our platform because you have been made a very clear-cut concept of myths which were there how about the pain. So and that's how it would help many other students to understand that how we can deal with these kind of things. So thank you so much for your approach and for your time
Yeah.
on our
Yeah,
platform.
this myth are actually what we really encounter. Like after 100, 200 patients, we have come to this conclusion that, okay, people come with this kind of pre-notion techniques of doing things, and which is not true. Even people are so aware of acupuncture nowadays, they will come and say, give us acupuncture. They don't know what is it, how it works. You give them 4 or 5 needles, they want like, give us 20, 30 needles and okay, we are done. So that is the thing. Some people read something from internet and like people think they know everything. So let's not go by Google. Keep your concept so clear that you can actually conceive patient, that your knowledge is more correct than the Google. So I think that is an achievement at the end of the day.
So thank you so much with your approach and insight to the pain management through our system of medicine, which is the yoga and naturopathy. So thank you so much for your time to all of us.
Thank you so much for having me. Good day.